guys, welcome back to my channel. It's Effie. In today's video, I'm back with another Why Do Arthritis Commercials Suck? In this part 2 video, I'm going to be looking at YouTube commercials I found for these 4 medications: Methotrexate, Xeljanz, Orencia, and Remicade. So stay tuned because that's coming all right up. If you haven't seen part 1 of this video series, I highly suggest you do so. I put the link in the description box below. In that part 1, I discussed more of the misleading aspects of certain commercials for Enbrel and Humira, and I believe it was Voltaren gel. In this one, I'm going to be looking at both the positive and negative aspects that are shown in the commercial, because not every commercial is misleading or negative. There are some positive aspects to it because, let's face it, these medications do give people the ability to live longer lives, thriving lives, and I know for me, if I didn't have these medications, I would be in big trouble. I just want to discuss some of these. I've only been on one of the medications I'm going to be talking about, and that is Methotrexate. So everything else is just going to be from the viewpoint of me viewing these commercials that I found on the internet. And if anyone has been on these medications, comment below and let me know. Let's get talking and share what your experiences are with these medications. When I was doing my research for this video, I didn't fully look at what I was choosing to discuss because I wanted to wait and watch these commercials or ads with you guys and react in real time. So I'm just going to start with the first one that I ended up seeing, and this is for Xeljanz from a place called iSpot TV. I don't know if this is on cable or what it is, don't know, but I just know that it's on YouTube and I'm going to click on it and let's see how it is.
Mornings were made for better things than rheumatoid arthritis. When considering another treatment, ask about Xeljanz, a pill for adults with moderate to severe rheumatoid arthritis when methotrexate has not helped enough. Xeljanz can help relieve joint pain and swelling, stiffness, and help stop further joint damage, even without methotrexate. Xeljanz can lower your ability to fight infections. Before and during treatment, your doctor should check for infections like TB and do blood tests. Tell your doctor if you've had hepatitis B or C, have flu-like symptoms, or are prone to infections. Serious, sometimes fatal infections, cancers, including lymphoma, and blood clots have happened. Taking a higher than recommended dose of Xeljanz for RA may increase risk of death. Tears in the stomach or intestines and serious allergic reactions have happened. Don't let another morning go by without asking your doctor about the pill first prescribed for RA more than 8 years ago. Xeljanz.
Okay, well, first things first, I like how this is not an injection or infusion. I hope in the future they can come out with more medications like this in a pill form so we don't have to deal with all that other stuff. I know for me personally, I'm just sick of taking injections for the past 17 years. If you're kind of in the same boat as me, you know what I'm talking about, that over time it gets old, right? I don't really like doing injections even though I do them weekly. You know, I have a choice, but at the end of the day I don't have a choice because I don't want to risk any more joint damage and I want to live my life to the fullest I am able to. All right, now I want to move on to the next commercial that I came across on YouTube, and it's from 2001 and it's for Remicade. So I just wanted to see how things were portrayed back then.
There's new hope for people with rheumatoid arthritis, a prescription drug that relieves pain and inhibits the progression of joint damage. It's called Remicade. Your doctor may prescribe Remicade if you're on methotrexate already and not responding well. You take 1 dose of Remicade every 8 weeks after the first 3 doses. Of course, Remicade is not for everyone. Serious infections requiring hospitalization have been reported. If you are prone to or have a history of infections, currently have one, or develop one while taking Remicade, tell your doctor right away. There's a risk of serious infusion reactions with hives, difficulty breathing, and low blood pressure. Ask your rheumatologist about Remicade.
Okay,
inhibiting progressive joint damage.
Let me backtrack all the way to the first few seconds. Okay, so right here where it says vacation canceled, and quote unquote, there's no hope for people with rheumatoid arthritis. That was the thought process back in 2001, which I wasn't diagnosed with rheumatoid arthritis until 2005. I may have seen this commercial on TV. I don't know, I don't remember. But back then, I had no idea what rheumatoid arthritis was. If anyone was diagnosed or living with RA back then, comment below and let me know, because I wonder what your thoughts were about this commercial. If you had seen it, if you remember it, if you've been on Remicade, how it's helped you, how it's not. And I just played it back again to make sure I heard it correctly. And yeah, they said there is no hope for people with rheumatoid arthritis. But then they introduced Remicade as something that can give hope to people. I mean, yeah, medications do give hope and better chance at life for people with rheumatoid arthritis, but I don't agree with what they had said there in their advertising. Again, it's the same like type of demographic shown in the commercial. So this was April 25th, 2021 Xeljanz. And then the Remicade commercial was in 2001. And you see here, it's still the same demographic, same type of person, same scenario. Where is the diversity and the inclusion within the past 2 decades here with these commercials specifically? And I'm sure this has happened with many others. And I talk about this in part 1 too, where the demographics are not showing like a big wide range of individuals living with arthritis. And in both of these commercials, you don't see necessarily any joint damage that's visible. You don't really get to see much other than someone who looks quote unquote healthy, which at the end of the day, we all know that rheumatoid arthritis and other autoimmune diseases can have that occur where you look fine on the outside, but on the inside, not everything is going that well. But again, it would have been nice if they could have included someone, you know, a real person, not an actor or an actress, made this a bit different, you know? And so I'm kind of disappointed that, you know, between 2001 and 2021, with 2 different medications and ads and commercials, there's still that sort of gap that's missing with representation, just showing like another side of arthritis that's not portrayed. And now for the next one, Methotrexate. I had trouble finding ads and commercials for this medication. I'm not sure if that's because it's been around for over 40 years, 50 years, and they just don't feel the need to make a commercial for it. And also it's used for a lot of other conditions. But I did find one from 2017 that's not really commercial, but it's more of like a getting started on methotrexate, and it's from Johns Hopkins Rheumatology, which is #1 for rheumatology in the United States. So let's see what that's all about.
Methotrexate is commonly used to treat rheumatoid arthritis and many other autoimmune and inflammatory conditions. In fact, it's the first line of treatment for most people after they're diagnosed, and it serves as the gold standard against which other treatments are evaluated. Methotrexate can be used by itself, but also it's frequently combined with other medications to control your disease. Methotrexate works by turning down parts of the immune system that are revved up in RA and other conditions. It helps get your body's inflammation back under control. When people first hear about methotrexate, they're often concerned because this medication is also used to treat some forms of cancer. But it's very important to remember the doses that rheumatologists use are hundreds of times smaller than the doses used for cancer. Therefore, many of the side effects seen with chemotherapy are not seen with the lower doses. Methotrexate has been used to treat autoimmune conditions since the 1980s. Its safety record and the doses that rheumatologists use, which are about 15 to 25 milligrams a week, guidelines for monitoring these side effects are all well established. In most people, methotrexate does not cause any problems. We also give a prescription for a vitamin called folic acid to take every day while you are on methotrexate. This helps to cut down many of the possible side effects. Sometimes another vitamin, folinic acid, or leucovorin, is also used. Methotrexate is taken once a week, not every day. It can be given as pills or in an injection. So you will choose a day of the week that works best for you, for example, Sunday. You'll then take your methotrexate every Sunday. Before taking this medication, your rheumatologist will check to make sure you're able to take methotrexate. You may not be prescribed methotrexate if you have cirrhosis of the liver or other liver diseases, if you have certain lung conditions, if you're a woman who is pregnant or trying to get pregnant, if you're a man who is trying to get someone pregnant, you have blood cell disorders such as anemia, which is a lack of red blood cells, or leukopenia, which is a lack of white blood.
Okay, I'm going to stop right there, but I love how they mention men, right? Because men have rheumatoid arthritis too, and oftentimes they are a neglected area of autoimmune diseases because majority of women have them. This is about 5 minutes long, and I have to say, where is this as a commercial? Because the way this woman laid everything out is amazing. I felt like comforted, I felt calm listening to her, and the way she explained things was so on point with what people need to know, you know? So let's continue. Let's see like a little bit more what she has to say.
If you're breastfeeding a baby, methotrexate can cause birth defects in the unborn baby. You should be on a sure method of birth control while taking methotrexate, whether you're a man or a woman. Tell your doctor right away if you become pregnant during your treatment. You may need to have a negative pregnancy test before starting treatment. Once you stop taking methotrexate, you should continue using birth control for at least 90 days before attempting pregnancy. Methotrexate is broken down by the liver. We generally recommend that people drink no more than 1 to 2 alcoholic beverages per week to minimize the chance of liver injury. Methotrexate comes in both pill and liquid form.
I just want to stop there because I heard back in 2017 when this was made that the rules for drinking on methotrexate have changed. I was told when I first got on it, I would say it was like 2015, that you shouldn't be drinking on it. I personally choose not to drink on methotrexate. That's just my preference.
Methotrexate works by turning down parts of the immune system that are revved up in RA and other conditions. It helps get your body's inflammation back under control.
Okay, so my favorite part was like when she started talking about how it can help. She had this little graphic that popped up.
The doses that rheumatologists use are hundreds of times smaller than the doses used for cancer.
And she makes it clear like the doses that are used to treat other conditions are way different than is used for people with RA. But I really enjoyed this a lot. I don't know about you guys, but I just feel that, oh, right here, this is what they should have in commercials, because a lot of times people don't understand what, hold on, let me just backtrack here.
Methotrexate can be used by itself, but also it's frequently combined with other medications to control your disease.
Yeah, so that's something that they should put in all commercials on TV, explaining what's going on with the body when you have rheumatoid arthritis and what these medications can help with, which is inflammation that drives the whole progression of joint damage and whatnot, is super important to bring back under control, and explaining like with that little graphic like what's going on with the body and how the medicine can help, I think will be super helpful for people. And I just know for me, like when I was diagnosed, I didn't really have these type of infomercials or commercials like available. It was more like what you just saw with Remicade in 2001, obviously, you know. I really like that. I think they did an amazing job. So props to Johns Hopkins Rheumatology. They're #1 for a reason, right? The last one, Orencia, there's one from 2009. And then let's click on that one. And then I'll choose one from, 2016 or 2017.
Arthritis. Everyday things can still be tough to handle. Can you open this?
No.
Pull this? Grasp this. Oh, yes, I can. What about you? If you think your treatment isn't helping enough, ask your rheumatologist about Orencia. It's an RA treatment that's proven to make a difference for many patients, including those who weren't helped enough by other treatments, relieving the symptoms of RA and controlling the advance of joint damage.
Do not take Orencia with another biologic medicine for RA due to an increased risk of serious infection. Orencia can cause serious side effects, including serious infections. Certain cancers have been reported. Tell your doctor if you are prone to or have any infection like an open sore or the flu. If you have a history of COPD, a chronic lung disease, Orencia may worsen your COPD.
Tell your doctor about the challenges you face every day with RA. Ask about Orencia and see if you could be saying, oh, yes, I can.
Okay, so at the end, I really like how they say, tell your rheumatologist about the challenges that you have with RA. They're basically saying, don't be afraid to speak up and have a conversation and be honest about all the struggles that you are dealing with so you can get the proper treatment. I appreciated how they don't go too heavy on like the side effects and stuff like that. They mention a couple things, but this one was improved compared to the other ones I just talked about for sure. You know, they give like a nod to having certain things be hard, and they ask us, the viewers, if we can open this, pull this, and oftentimes, no, we can't pull zippers. We need zipper pulls, or we need an assistive device to open a can of, I don't know, tomato sauce or a bottle of water, right? And in this commercial from 2017 for Orencia, it features an actual Orencia patient. And I was told under one of the Instagram reels that I'm going to mention at the end of this video that I did, from someone saying that psoriatic arthritis commercials, they feature real people with psoriasis in their advertisements and commercials. And I was replying to her saying like, oh, they should, you know, hopefully do that for rheumatoid arthritis commercials. And now I just came across that, so that's so weird. Okay, just had a moment.
I'm Shannon, and this is my RA story. I love the game, but I'm not a fan of pain and swelling. My moderate to severe rheumatoid arthritis often made simple things seem intimidating.
If RA is changing your view of everyday things, Orencia may help. Orencia works differently by targeting a source of RA early in the inflammation process. Orencia reduces pain and swelling. It's helped new RA patients and those not helped enough by other treatments, including Methotrexate. Do not take Orencia with another biologic medicine for RA due to an increased risk of serious infection. Serious side effects can occur, including fatal infections. Cases of lymphoma and lung cancer have been reported. Tell your doctor if you're prone to or have any infection like an open sore, the flu, or a history of COPD, a chronic lung disease. Orencia may worsen your COPD.
Orencia helps me get back to the things I love.
If you're not getting the relief
So yeah, you know, they feature someone who is using Orencia to treat their rheumatoid arthritis. Again, same demographic. You don't really see anyone who is of a different ethnicity or race represented, and I don't know why that is, but I would have really liked to hear like more of her experience rather than the side effects listed again and having the word fatal and all those things like pop up in my ear. I just felt it could have been more of like an interview style, but also like a commercial mixed in, so then you can kind of get her experience more. I see like they're trying to show like her like enjoying the game of softball or baseball and her wanting to get back to doing all those things, but you don't really get to see much of her thought process in it, if that makes sense. So I'm going to end this with one more here. We'll do this one. So this is another Orencia patient.
I'm Rebecca, and this is my RA story. I never pictured myself intimidated by the things I love to do, but the pain and swelling of my moderate to severe rheumatoid arthritis often made doing something simple difficult.
If RA is changing your view of everyday things, Orencia may help. Orencia works differently by targeting a source of RA early in the inflammation process.
Okay, so that's weird because I didn't plan this out at all. I didn't watch these before making this video. I was saying how I wish we can hear more from her and like see a little bit like more of her interests other than playing softball. And so this one seemed a little bit closer to that. I just feel like during this time when they're mentioning like the side effects, we can hear more from this person who lives with rheumatoid arthritis and is taking the medication. I don't know if you guys feel the same. But I just feel it's kind of tacky too for her to sit in like, I don't know, an art museum and like sketch while it's like listing all these things that can go wrong when taking the medication. So it's like kind of counterproductive in a way, like their messaging. In any case, yeah, so hold on, I think there's one more I wanted to show. This is called targeting the source of symptom. I feel it's gonna be like the same thing over and over again. They just put someone in the beginning and then they have the same messaging, which kind of gets old after a while.
With the pain and swelling of my moderate to severe rheumatoid arthritis.
Okay, and let me pause right there because I just noticed the artist who they featured in the Orencia commercial, who was a real patient, she was of Hispanic descent, I believe. I don't want to make assumptions, but she was not Caucasian like all the other people in the commercials that I've talked about, like 6 of them, maybe 5 of them so far, ranging from 2001 all the way up until now. So that's a little bit of a shocker where it's just like one person is a different demographic in that commercial. So the next one I'm going to show is back to the old ways of like showing just one specific type of age and person in the commercial. So it's like, again, another like middle-aged white person, and then you don't really see much else in these commercials.
Ordinary objects often seemed intimidating.
Doing something simple meant enduring a lot of pain.
If RA is changing your view of everyday things, Orencia may help. Orencia works differently by targeting a source of RA early.
Yeah, I don't understand like what the point is of like just showing these people like walking and taking photos. I don't know what this is all about, but I don't like it. So in any case, I think you guys get what I'm trying to say with this. It's just interesting, you know, like how things have evolved over time and what still needs to be done a little better when it comes to representation. So that's all I have for this video. I hope you guys found it informative, relatable, or if you feel any type of way when viewing these ads and commercials, let me know in the comments below like what your thoughts are. So yeah, anyways, I think I pretty much covered all the medications in part 1 and part 2. I may do a part 3 where I look at other commercials for other conditions and diseases and see how they make their commercials, because I'm pretty curious as to how they put together the psoriatic arthritis commercials for patients and how they craft that messaging when they show someone who's really living with the disease. That's all I have for this video. Until next time, bye.